started. Welcome to today's presentation from WIMS called Phenomenal Skin at All Ages. My name is Paige Geiger. I'm the secretary of WIMS, and Dr. Julie Way was not supposed to be here today, so it's a bonus that she is, but so I was planning to introduce the speakers, so that's why I'm up here today. And we're glad that you all could make it. We have a very interesting panel of local experts here for you today to talk about our skin. And so our three presenters today are going to be Dr. Daniel Ayers. And Dr. Ayers is a professor in the Division of Dermatology, which is in internal medicine. And then we have Dr. Clint Humphrey, who is in the Department of Otolaryngology, and then we have Dr. Corin Tager, who is the chair and associate professor of plastic surgery. So interestingly, three experts in skin, all from different departments. So I think that bodes well for the knowledge that we can gather today. And so we wanted this to be informative, but also fun for all of you. We've got three experts here today that you can ask any question you can possibly think of about skin, and I'm sure they'll be able to field those. And we all there's not anyone that could probably argue against wanting beautiful skin. I mean, we all would like that, but we also want to remember that our skin is our first line of defense against the environment. And so hopefully the experts today will talk to us about the importance of maintaining our skin and all the great things that they can teach us. And with that, I think Dr. Humphrey is going to start off. Okay.
Well, thank you for having us here today, Julie. Thank you for inviting us. It's a real honor to get to talk to a group that's pretty educated. We give these talks to lay people all the time, so if you feel like I'm talking down to you at any point, just let me know, and we can throw in a few more technical words and make it more complicated. But I'm going to start off. You've got the real privilege of having the dermatologist here, who really knows the most about the skin. Mine's this remedial talk about what happens to the skin with aging, and like I said, I can get away with it most of the time because we're talking to the lay people, but he's going to give you the more the truth about what really happens, and I'll give you kind of this, like I said, a remedial overview and talk about some of the things we do to treat, including laser, including topical treatments, and then I think that Dr. Ayers is going to talk about some of the injectables we do, and Dr. Corin Tager is going to talk about some of the treatments as well. So we'll start out with causes of facial aging. We'll talk about the changes that are really occurring in terms of skin texture, skin pigmentation, abnormal vascularity that you see, and then finally, the worst thing that can happen with long-term sun exposure, which is skin cancer. So you can't have a talk about aging without talking about sun exposure. There's certainly changes that occur in the skin with just chronological aging, but over 90% of the things we see and the things that you become concerned about over time are due to photo aging. And really, you do need some sun, but it amounts to just 5 to 10 minutes a few times a week. Anything beyond that is really just contributing to aging and problems with the skin. More recently, we have heard about vitamin D deficiency, but you may need vitamin D supplementation later in life, but no one's recommending that you get more sun exposure to take care of your vitamin D problems. And so certainly the risk of sun exposure outweigh the benefits, and those include the aging and also skin cancer. So what are some of the changes we see with chronic sun exposure? Our department actually does a lot of medical mission work. This is a picture of a Nepalese lady, and she's been out in the sun her entire life, and so she has the whole gamut of changes here. She's got loss of skin elasticity with deepening of the lines in the skin. With the loss of skin texture, she's got sagging and wrinkling of the skin. If you looked very closely, you could see some of these pigmented spots and also the telangiectasias that form over time. In addition to sun, and fortunately we're talking to medical people here, hopefully there's not too many smokers in the audience, but if there's one thing you can do to really amplify all those changes that happen because of sun exposure, it's tobacco smoking. The literature says you start to see a lot of those changes after about 10 years of smoking. Part of the changes become because of characteristic facial expressions, including puckering the lips. Those contribute to the vertical lines we see around the mouth and the deeper lines around the eyes. Again, they accelerate all those other changes that you see due to sun exposure. And finally, there's really a decreased blood supply to the skin. And when we do surgery, we worry about healing, but just in general. Damage occurs to the skin over time. There's less collagen, less elastin in the skin, leads to poorer skin texture. Here's a picture of a gentleman. You can see that characteristic smoker's expression, really squinting the eyes, puckering the lips. These are some interesting pictures. These are actually twins. These are from a medical website, actually. These are twins. They even have the same piercing and the same earrings on. And taken, I would say she's probably in her 40s. The only difference between these two ladies is maybe a difference in sun exposure, but certainly one of them smokes, and it's the one on your right. And you can see how she has deeper lines on the face, more pigment changes. You can see the very characteristic lines around the lips. So it makes a big difference. Close-up shows the same thing. Here's a split image, also twins, and you can see on the right side, that's the twin that's got the sun exposure and tobacco smoking. So same age, makes a huge difference over time. So what are some of the, in depth, what are some of the changes that we see? Well, here's a typical patient that comes into my office with the doctor. I have this turkey neck. What can I do about this? And there are some less invasive treatments you can do when you get to the point where there's a lot of excess skin. Mostly surgery is going to be helpful. But all of these changes occur, again, mostly because of the sun exposure. Specifically what happens is there is a buildup of old damaged cells in the very superficial layer of skin, the epidermis. In addition, there's a poor connection between the two outer layers of the skin, the epidermis and the dermis. There's less moisture in that layer. This leads to a very dull, parched, dry appearance to the skin. It also leads, as you get very old, very light touches and injuries will cause blistering and bruising in the skin. With the next layer, the dermis, there's fewer fibroblasts. This is the biggest part of texture to the skin, is that there's less collagen. And so you don't have that very tense, smooth skin that you have when you're younger. Instead, the skin starts to fall with gravity, sagging and wrinkling. So moving on from texture to pigmentation. What happens with pigmentation of the skin is as you get older, there's fewer melanocytes. So if you didn't have any sun exposure, the skin actually might get a little bit lighter. Not true for most of us that have had lots of sun exposure. The few melanocytes that are still there get a little bit bigger, form abnormal pigment. This leads to the brown spots, the liver spots, and those are undesirable. Here's a few pictures of that. This is actually my wife. She unfortunately serves as the guinea pig for some of the treatments we do in the office. And she's very fair-skinned. He's German descent, and on your left side here, you can see that she has a lot of these sunspots. This is actually after a phototherapy treatment. We all offer these in our offices, I think, and you can get a pretty dramatic result. This is under basically black light, which amplifies the pigment in the skin. You can see that it makes a pretty big difference. This is another example of the pigmentation in the skin and after treatment. You can also accomplish a lot of these changes and improve the pigment with skincare. Topical treatments will do the same thing. They just take much longer. This is after many months of treatment. So moving on from pigment changes to vascular changes, and when we talk about that, it's primarily what are commonly called spider veins that are seen in the skin. The reason that we begin to see those is the blood vessels begin to thicken, they begin to dilate. They're weaker and more fragile. That's what causes the bruising, easy bleeding. Here's a close-up of those typical changes. These, again, respond very well to the phototherapy, some of the laser treatments in the same way that the brown spots do. And then finally, the thing that none of us want to have is skin cancer. And this is an example of a basal cell carcinoma you can see on the upper lip here. Other types that are more aggressive include squamous cell carcinoma and melanoma. these are sometimes very difficult to see at the beginning. Very common, and Dr. Ayers sees this more often than I do, but the patients come into the office and say, I've just had this little pimple here, or I've had a scabbing spot. Even for medical professionals, these can get past you sometimes. If you have a spot that's not going away, you should really get it checked out. And the worst thing about these is that sometimes they amount to much more than they seem. This is after her Mohs surgery. That lesion was much larger than it looked just on the surface, a very infiltrative lesion. Fortunately, she did very well after reconstruction. She's doing fine now. So some of the other things we do for treatment of all the problems that we talked about. Number one, if you're going to do one thing for your skin every day, it's to avoid sun exposure. And for those of you in the audience that are younger, you won't need a lot of these other things later on if you use your sunscreen every day. And really, it does have to be every day. It shouldn't just be when you're going to spend the day on the beach. It needs to be every morning. Even the time you spend walking to and from the car is more sun exposure than you need. And it makes a big difference to protect yourself from that. And not only on the face, but also on the hands, any areas that are going to be exposed. So that's the number one thing. After that, there are a lot of other topical things, and as you saw in the pictures, with consistent use, they can make a big difference. The retinoic acid increases turnover in the skin, can help you get rid of some of those old cells, increase collagen production, improve the skin texture. The alpha hydroxy acids, antioxidants, purported to do some of those same things. Hydroquinone specifically is going to help with the pigment that you see in the skin, the brown spots. And then finally, if you want to accomplish those changes a little bit quicker, we offer superficial peels and laser treatments. With that comes a little more downtime. With the topical treatments you do every day, not so much downtime. With the laser treatments and peels that really make a difference, you are going to have a few days downtime. We have better lasers now. We have better ways of doing the peels to limit that downtime. But certainly, you're going to have some scabbing, have some redness of the skin for a few days after those treatments. And that's actually all I have. I'll turn it over to Dr. Ayers, and he'll talk to you some more. Let's see, how do we switch?
We need technical assistance.
I know we
got to play this.
It may switch.
Oh, well, maybe it will. Hang on.
There you go. It's up. I'll just leave mine up here.
Oh, this is locked, though.
Perfect. All right. This.
Nice. All right. Well, I'm Dan Iris, and that was great, by the way, Clint. And he's covered a lot of topics. I may take mine a little bit out of order because he covered some topics so well. So, without further ado, let's march into this. Please stop me anytime anyone has questions, okay? I really prefer to not hear my own voice the whole time. So, the overview, though, is there are 7 things that drive skin aging. 3 of them are kind of outside factors, and I think that Clint really just did a fabulous job with that. That's smoking, sun, and SkinCeuticals and surgery. And then there are also 4 inside-out ones. I've labored to make these all start with S. Stress, sweat, which is good, sleep, and I'm using salad as a shortcut for what we eat. And again, I think I might skip ahead to the inside-outs, and we'll circle back to the outside-ins at the end. So actually, you know what? You just saw that. Smoking, bad. Sun, bad. You need some vitamin D. You'll probably get enough of that just walking around. This is the key thing, and pardon my slightly offensive pictures there, but if you want to protect yourself from the sun, a sunproof shirt is really not the way to go. Maybe when you're rafting, but what you really want to protect is your face and your hands. If everyone wants to do a little experiment, make a fist and stick your hand out, all right? Now, just one fist. With the other hand, pinch your arm and see how easy that would be to pinch some skin and let's say have Clint or me or someone else cut off a piece of it. Easy. Now try to pinch your back of your fist. Hard, isn't it? Not a whole lot of skin there. And how about your face? Who here would love to have a biopsy and a scar on the face? Didn't think so. So, wear your hat, wear your gloves. Don't worry quite as much about your back, or your chest, or your tummy, or your legs. Okay? Hat, gloves. All right, now we can leave those. And here comes Dr. Corntager. All right, probably in the OR making someone beautiful, right? All right, so, and again, we'll come back to this. I can talk a little about Botox. It's something we do a lot of. We're a teaching clinic, and we focus a lot on the facial anatomy, and we definitely, we like Botox patients. There's a lot you can do. There are a few home runs. Basically, the frowny lines, people always looking unhappy, that's a home run. You can just wipe that out pretty easy. Not so big on the forehead lines. Everyone has them. Women in their 20s have them. And if you take care of the forehead lines, you'll often drop the eyebrow down, get the kind of Jack Nicholson look, which women don't like. So you stick with the home runs, I'd say. The glabellar lines are great. Periorbital lines are great. The smile lines. And masseter reduction, which, some women get that. It's a fabulous treatment. Questions, comments? Oh, that's the kind of square jaw some women get as they get older, and it's from clenching the jaw a little bit, maybe at night, maybe excessive teeth grinding. Yes, whatever you said, it's right. Botox. We inject Botox. This is all Botox stuff. Yeah, if you clench right here, you can feel these muscles, and you can inject them, and over time you shrink them a little bit. And I happen to be intimately acquainted with someone who had this and is very happy with it. So they don't clench them quite. You don't clench them quite as much. It can return somewhat, and you have to, all Botox. Botox is temporary, which is both a curse and a blessing. And it's a curse because you have to keep coming back any more. Although over time it's less and less because the muscle slowly gets weaker. And these are not important muscles. I mean, you don't want to weaken a muscle that matters. But masseters matter, but you can shrink them by 30% without a big problem in function. It depends on the person. I've seen some people for whom Botox is, I had Botox once, only once. But for me it lasted, I probably need it again, but it lasted like a good year or two. And, it doesn't freeze your face, but I have allergy lines here. And my allergy lines went away for like a year or so, maybe even more. But typically we say 3 months, especially at first, 3 months, then 4 months, then 6 months, then 8 months, etc. Well, I think really, any fifth grader can put out a sign and say, I'm doing a Botox. The question is, how skilled is the person doing it, and do they know the anatomy? Oh. It can be, yeah. I would leave that more to a dentist or a neurologist or someone who really understood the bruxism and, because there might be other issues. I wouldn't want to say, oh, all that matters here is the aesthetics. But for someone who's basically healthy and does have an aesthetic issue, it can work really well. Yeah. Other comments, questions, thoughts on that one? Okay. Well, great point. What's that? Yeah, but again, I think great point. I'm sorry, who you are? I should know you, but I don't. Great. Well, that's okay. Well, no, that's great. Well, I think you bring up a great point. Yeah, no, I think you bring up a great point, which is, if there. Oh, I'm sorry. The question from before, which I didn't repeat. Shouldn't dentists be interested in this? And the answer is yes, because if there is a bruxism issue, a jaw pain issue, absolutely go to a dentist. If there's a migraine issue, go to a neurologist. This is strictly the cosmetic/beauty end of Botox, so not for medical issues. All right, now to my personal obsession, which is skin is a window into health, and this is a study from about a decade ago, and basically they looked at skin topography, real close-up photos of skin, plasma DHEA. The punchline, the headline is they show decreased skin wrinkling in sun-protected sites, areas that never see the sun, in women who had better health and daily functioning. And this is more in women than men, so sadly for us, we can be as healthy as we like. It may not help. And they controlled for age, BMI, and tobacco use. So skin is indeed a window into health, which is kind of intuitive, but this is some nice data behind it. So therefore, let's go to these 4 inside things, and I'm going to march through them in order pretty quickly. And again, stop with any questions. First one is stress. Chronic stress decreases longevity, loads. Go ahead. No. Mood disorders. This is a study that's illuminating. Mothers of chronically ill children have a decade plus of increased aging from stress. So furthermore, stress and optimism is a predictor of longevity. Pardon the ugly red line. The initially had a white line that just didn't show. But this is a 40-year study of 7,000 students. And the bottom line is that the most optimistic third outlived the others by quite a bit, and the least optimistic third died sooner. So for further reading, I'm a huge, huge fan of this book. It's called Learned Optimism by the person who actually described learned helplessness. But in a nutshell, and please get the book, don't just take what's in the nutshell, it's when something goes wrong, you can either say, oh my gosh, I stink. That's personal, pervasive, and permanent. Or you can say, let's say you kick the ball and it doesn't go where you want. You can say, well, the wind's against it. The wind isn't personal. It's not pervasive. And Lord knows it's not permanent. It changes like the wind. So that's a big, big thing. Sweat. Again, this is so obvious. I'm not going to belabor it, but exercise regularly. Makes a huge, huge difference in health and longevity. Loads and loads of studies, and I don't want to read all these out loud. But there are loads and loads of studies showing exercise improves overall health, it reduces all kinds of measures of aging, and it improves longevity. And that's true whether you're 5 or 50 or 100. Okay, sleep. Sleep, I think, is underappreciated at this point in Western medicine. Sleep does increase longevity, and there's a mouse study showing that when they give them a little extra sleep, they increase the maximum lifespan by 1/4, and that's pretty good for a mouse. Elderly Japanese women, they die sooner if they don't get enough sleep. Mutant flies die earlier if they don't get enough sleep. Short-term sleep debt looks a lot like aging. Decreased glucose tolerance, increased cortisol, increased sympathetic activity. Longer-term sleep deprivation associated with obesity, diabetes, hypertension. So again, this is basic sleep hygiene, and there's a book I should also put on here, and I didn't, with a tiny twist of my own. So basically, my guess is at least 1/3 of the people in this room have sleep issues. I certainly, the reason I became so obsessed with this is I certainly had some after I came here and suddenly had a lot of stuff on my mind. Pre-bed, you want to ideally exercise sometime in the day, raise your body temp, or you can use a hot bath if you really don't want to exercise, or you just like hot baths. 2 hours before bed, there's a toughie, turn off the TV, turn off the web. Have a light, relatively non-fatty dinner, again, try to keep it at least 2 hours before bed. Have low orange lights, so not those little pigtail fluorescents, old-fashioned Thomas Edison light bulbs. And then my little addition, approved by my psychiatrist brother, activate your parasympathetic. So read about food or something else that's going to activate your parasympathetic. The bedroom, keep it cool and dark. I should say quiet too. Sleep hygiene. Use the bedroom only for sleep and other bed-related activities. You can figure out what those are. Same wake-up time every day. And this is a toughie. If you're out of bed, if you're awake for more than 15 minutes, get out of the bedroom. And there's a wonderful book, I'll have to put the title in here next time, written by a female scientist whose name I'm blocking on, but she runs the Stanford Sleep Program. And the book is called Quiet Your Mind and Get to Sleep, and it is phenomenal. And it's basically how to get out of bed if you're awake. You train your brain like a Pavlovian dog to stop going over your to-do list at night, which was my problem. All right, we're on salad. So again, I've kept everything with S's, and the second S is pretty weak. If someone thinks of a better one, please let me know. So sugar, skip the high glycemic load foods. This is tough in America. This means avoid everything in the supermarket except the stuff at the periphery. The frozen fruits and vegetables and the regular fruits and vegetables and the meats, cheeses. Everything else, all the stuff with the ingredient lists, don't eat it. Okay, skip supplements. We're going to get a little more on that. Strawberries, eating whole foods, things based on whole foods. And starving, fasting occasionally, if so inclined. That's a toughie. Some people do it. Some cultures do it. All right, so I think we're all familiar with, the crispy crust on a cookie. That's one type of browning or Maillard reaction. It's non-enzymatic cross-linking of sugars, non-enzymatic glycation, and they're called advanced glycation end products, or AGE. And when you get older, you can't stretch anymore. Your parts don't stretch, not you guys. But the reason is partly you've sugared them. We as Americans have sugared ourselves. So cut out the sugar. We all know insulin resistance, metabolic syndrome. I think something just came out a couple weeks ago about increased Alzheimer's associated with increased glycemic load and index. So in low glycemic diets reduce all these indices in diabetic patients. This is the thing about vitamins and antioxidants, and I'm not talking about skin. If you want to rub antioxidants on your skin, great. But take them by mouth, be a little careful. There's a great study they did in Germany, so they did it right. They did muscle biopsies. But oral antioxidants, C and E, in fairly normal doses, 400 of E, 1,000 of C, prevented the benefit of exercise. Basically, these subjects might as well just stayed home, not gone to the gym if they took their vitamins. And there's another thing that's kind of, I think, not as widely appreciated maybe as it could be, is, antioxidants aren't an unalloyed good. Vitamin C and E are certainly not an unalloyed good. And it's smart. C is water-soluble, E is lipid-soluble, so I think they really covered the bases with the study. And the theory is, at least, that free radicals play an important role in signaling. So if you want to go to the gym and have your body know you went to the gym and react accordingly, don't flood it with antioxidants. Yeah?
Which effects it prevented? Which health-promoting effects?
Sure. What this is glucose tolerance and also plasma adiponectin, and these are both indicators of fitness. The people in better shape will have a better reaction. Lance Armstrong will do better than I will. And what you can see is that training improved this. Basically, going to the gym, this is all physical training, going to the gym, I think for 6 weeks or something, made their insulin response better. And A is previously untrained people, very sedentary people. B are previously trained people, and I'm guessing most of us in this room probably work out. But, let's say we're working out, but then we go into a program and work it even harder. It makes our insulin response better. But if we pop our vitamin C and E every day, it doesn't make it better. We may just as well have not gone to the gym. Is that kind of okay? Okay, next, salad. Whole old foods. Phosphates are found in soft drinks and processed foods, and there's data showing phosphate ages mammals. There's also the Clotho mouse. When I first came here, the head of renal said, you need to study the Clotho mouse because you're interested in aging. I didn't. I'm kind of glad I didn't because someone else solved it. Basically, the Clotho mouse doesn't handle phosphate well. If you just suck the phosphate out, the mouse ages fine. And phosphate in our diets comes mostly from all those things in the grocery store that aren't at the periphery. Virtually everything processed has phosphate. So another reason not to eat processed foods. And my summary now for patients is not avoid this, avoid this. It's if it has an ingredient list, try not to eat it. If it is an ingredient, you can eat it. Chicken, apple, lettuce. But if it has an ingredient list, even if it's like a super health bar with added antioxidants, don't eat it. And whole old foods have lots of benefits. Mediterranean diet has benefit in lots of clinical trials. Tomatoes have hundreds of different carotenoids. It's not like there's just one magic, tomatoine. That's the reason you should eat tomatoes. Same thing with cumin, turmeric. Polyphenol plants are probably playing an important role in all these benefits of plants. They seem to reverse age-related declines in neuronal signal transduction. And I'm not going to bore you with all the details, but there's loads and loads and loads. Thousands of papers on this basic topic. I want to toot our horn and ask a question here. I want to do a little research right now, product research. A study that we did, actually with Haozu, among others, looking at a blend of plant polyphenols, whole plant polyphenols, seemed to help in calorically restricted mice. Caloric restriction has been the gold standard of aging. And in this slide, you can see the control mice are dying, the purple line, around 24 months. The IF is the gold standard, intermittent fasting. So these are mice that skipped meals Monday, Wednesday, Friday. And the IF plus AO did even better, and the AO is this antioxidant plant blend. We were still calling it antioxidant, but really it's polyphenols. And my question is this. Raise your hand if you might be interested in getting Jayhawk blend to sprinkle on your food. Is that something that's appealing or something that's kind of like, eh? Well, no, it tastes kind of good. I've eaten it. It tastes kind of good. It's like blueberries, tea, pomegranate. Well, I'm just curious. Huh. All right. Wow. No vitamins. No vitamins, no. I don't like, oh, sorry, the question was it's not vitamins, no. Chemicals, bad. Food's good. That's the, okay, just curious, because KU is in the middle of patenting this, and we're trying to see is it something that people might be interested in. So at least Jayhawks might be. Outstanding question. We know it helps in mice that fast. We don't know anything about humans that don't fast. You're right, we don't. No clue. I mean, it seems to be good. Since we got our data, everyone in the study has been eating blueberries, drinking green tea, and doing all the rest of it. And I think I wouldn't mind just sprinkling a teaspoon of the stuff on stuff sometimes when I'm in a hurry. So I probably would be a customer. But you raise a great question, which is more study is needed in humans. How about doing the same thing in normal, non-fasted humans and seeing what it does for us? So it's a good question. Don't have an answer. Yeah. Was there another? No. Okay. So, okay, let's open up to questions, I guess. Especially we have all three of us here now. We can play past the mic. Just come up. Any question about anything? Yeah. Oh, did you bring a presentation? Hang on. Don't want to be rude. You brought a presentation? Oh, hang on a minute. We have a presentation.
Although after that presentation, I'm sort of feeling so I'm probably about to die. I do, everything is wrong. I should, hopefully not. Yeah.
I was going to ask about Aldera that seems to help with some sun damage, but also helps wrinkles.
Yeah, that's a great point. Aldera the question was how about Aldera that helps with sun and wrinkles? Aldera is a TLR 7 and 8 ligand. It induces a local immune response. It's approved for venereal warts and cancer, and it works works great for both. It also happens to make things younger and get rid of wrinkles. And I'm actually trying to do a little project on that right now too, because my hunch is it's doing that by eliminating senescent cells. There was a nice study recently showing that senescent cells cause aging in mice. So it isn't just that senescent cells don't just kind of get senescent and sit there. They appear to damage their neighbors. So I would wonder if what imiquimod aldera is doing is killing off the senescent cells and thereby, thereby changing the phenotype. But cool stuff. Unfortunately, it still costs like $700 to get a 6-month supply. But if you really want to get younger, especially if you have significant sun damage, it's a great way to go. All right, Dr. Korntager.
Yeah, I was just going to say, I think I finished this last night at about midnight, and I think I do everything wrong that Dr. Aries was just talking about. Julie Way and I often, will be sending emails back and forth, and her last email to me will be, get off the computer, go to bed. So, yeah, it's, there's all sorts of things. In plastic surgery, one of the fun things for us is that it does, we get to interact with all the different, sort of areas. We do a lot of work. I want to do that. We do a lot of work with Dan and his group, and Clint and I do, we all do things together, and it's sort of a lot of fun. And I think this is great that we're, doing this. Unfortunately, what delayed me was not something that was attractive. It was a hand caught in a forklift. So the part that I'm just going to go pretty quickly and briefly through this. I just wanted to give a quick idea about some of the things that we have all three of us have utilized at different times in the treatment of aging skin. So, one of the things, plastic surgery, one of the funny things, questions that I'm often getting from patients is, where did the plastic sort of come from? And, it came from a Greek word, so it's actually not that we tend to use plastic, but it's to form in the mold. So the thing that we're really interested in is the form of skin, the mold, how things are working all together and functionally. And one of the things that I find is really interesting, when you talk about cosmetics, cosmetic surgery, anti-aging, things like this. As we speak, one of my partners, Brian Andrews, is in Honduras, working on kids with clefts. And so that's something where they don't have the ability to deal with that as part of any health insurance. So it's, in a sense, a cosmetic problem. Here we've got completely different sort of view of these things. Plastic surgery goes way back through the ages, and if you look back at the ancient Egyptian, papyrus and hieroglyphics, there are descriptions of the use of salves and different things to try to help with aging. And unfortunately, I missed some of what was spoken about before, but, going back to the time of Cleopatra, there was, using curdled milk, using other things like glycolics to help with the skin. So, nothing that we're doing is new. This is all stuff that is just being rediscovered and, hopefully expanded. We're starting to understand the reason behind a lot of it. A lot of plastic surgery has sort of developed as a result of trying to solve other non-cosmetic problems. So I'm going to talk a little bit about some of our light-based treatments, and they were originally developed not for cosmetic enhancement, but for treatment of congenital deformities and those kinds of things. So aging, I think we've all talked about that, and you've got, Dr. Ayers was just giving you a great description of all the different, factors that deal with aging. So what I'm going to talk about just really briefly here are some of the light-based treatments that we're doing. And they're things that I've been getting very excited about and have found a tremendous benefit in our practice. So essentially, we sort of divide them into two broad groups. There are the lasers, and the laser treatments are just a single wavelength of light, and then the intense pulse light, which is a range of wavelengths. So the whole concept with any of these treatments is that you're trying to target something called a chromophore within the skin. So you're trying to target something in particular that you're going to impart energy to, you're going to heat. And that can be a blood vessel if the target is hemoglobin. It can be a hair follicle if it's melanin, or it can be pigment in the skin if it's melanin, or it can be the water in the skin, the water content of the skin. So we target all of these different things, and they do different things depending on what we're targeting. It's really essential, and it's funny, one of the question that came up is, will our dentists using Botox, and we see people throughout the community looking at some of these things and saying, it's just a little Botox, or it's just a little injectable, it's easy, it's quick. The light-based treatments, a lot of it is the same. You've got people who are saying, look, you're just putting a machine on and hitting a button and go bzz, and then you're done. The problem is, a lot of the time, the devil is in the details. It's in knowing exactly where to put that Botox, exactly what layers to put the product in that you're using as a filler, what product you should be using. And with the light-based treatments, it's a matter of understanding the skin, understanding the character of the skin, how it's going to interact, how it's going to react, and how it's going to react at different times of the year, depending on how much pigment is in your skin at any one time. So we've talked, interesting, that's what happens when you do this in the middle of the night. You get these overlaps here. So the first one that I'm going to talk about, and again, this is just an example of a broad group. The Limelight, that's something, it's an intense pulse light treatment that is with a company, made by a company called Cutera. It is a platform that we use to apply an intense light to the skin. And in this particular case, we're using this range of wavelengths, so between 520 and 1100 nanometers. And the particular chromophores that and targets that it is attracted to is some of the red in hemoglobin. That's that lower end of the spectrum around the 520, 580 wavelength. And then as you go up in the spectrum, you're getting into some of the pigment and some those structures within the skin. So you're affecting these more than one, you have more than one target with this because you've got this broader wavelength of light. It can be very effective. The big thing with these treatments is the depth that you can treat without causing problems. So the second one, I'm just going to describe these three sort of systems and then just show you a few quick pictures, and then we'll just open it up to any other questions. So the second one that I really like to use, I find very interesting these days, is something called a pearl. The pearl system is a laser, and we use different wavelengths of laser that have different characteristics. So you may have heard of CO2 lasers or erbium lasers. With the CO2 laser, it's a very powerful, it can be a very powerful laser that tends to have a lot of thermal damage. A lot of heat is generated as a result. And then something called an erbium, which is a different wavelength, where there's a lot less heat generated in the surrounding tissues, but it can be effective of getting rid of some of the surface layers of the skin. Depending on the power of the laser, the fluence, and the pulse durations, you can go more deeply through the epidermis into the dermis, or stay more superficially. The pearl is one that has a wavelength that's sort of in between the CO2 and the erbium. The reason that I've tended to like it is that it has some of the characteristics of the heating, which is helpful in getting rid of some lines in the skin. And then it's also got some characteristics of the erbium where you can get rid of some of those superficial lesions without causing a lot of damage to the skin. Recovery with these, as opposed to especially the CO2 laser, is very quick. It can be within a couple of days. Literally, you can have just a little bit of redness in the skin and see some nice changes. Fractional treatment is a newer concept. You may have heard of the Fraxel, which, when you talk about, ketchup versus, or, Kleenex versus tissues, Fraxel is the name of the company that sort of invented this and marketed it. So it's become sort of a generic name. But it's really referring to what we call a fractionated treatment. So using the same wavelength, when we use it in this broader setting of the pearl, it just takes off a layer of skin. Whereas with a fractional, you're cutting deeply into the skin, but in very tiny computer-generated little holes. And this just gives you an example of the different types. So with the ablative resurfacing, which you see on your left, you can see depending on the depth that you go, it sort of takes off this broad area. When we're looking at these fractionated treatments, it essentially drills tiny holes into the skin, and so you get a much deeper penetration, but yet you have these intervening areas of normal skin, and that really speeds up the healing. So here's just a few examples. So the Limelight, again, that's what happens when it's late at night. You see, this is an individual who has a lot of pigmentation in the cheek. It's something you see pretty commonly. It can be a post-inflammatory problem. It can be just an aging problem. But you end up with this irregular pigmentation. It can be very hard to deal with. Using this intense pulse light treatment, it's a way of getting rid of that. Now, the caveat is that if you simply do this and then don't do the skincare treatments that were discussed, you're just going to get it back. So the analogy that I use is that just like brushing your teeth, you wouldn't think, oh, I brushed my teeth last week, so I don't need to do it again for a couple weeks. Skincare is the same. Skincare is something you got to do it every day. You got to do it morning and night. You've got to be committed to it. And when Dr. Aries was talking about, the $700 for a 6-month supply, I've got patients who come in who tell me they have thousands of dollars worth of creams and salves that they've got at the, at Nordstrom's. Yeah. You go, whether it's Lancôme or La Prairie, you can pick up a nice little, tub of eye cream there for $200-300. So if you can find something that really works. So these light-based treatments can be very effective, but just to think, oh, I'll just do that and I don't have to do the skincare, that doesn't work. So here's an example of the fractional. Now, the nice thing about the fractional treatment is that you can actually get rid of a lot of the lines, the non-dynamic lines. When Dr. Ayers was talking about the Botox, that's dealing with dynamic lines in the skin a lot of the time that you're trying to deal with, whether it's in the glabella, in the periorbital region. This is a way of dealing with the non-dynamic, those lines that are just sort of there at rest. Again, often the result of chronic sun exposure, environmental causes, the health, weight gain, weight loss, all of these different things. So this is just an example of how significant a change you can get, and that's over a 6-week period. Here's an example of, this is a patient who I did this pearl, what we would call a pearl fusion. So it was a combination of using the fractionated as well as the regular pearl treatment. But you can see the change. That's about 3 weeks post. So just before and then 3 weeks after. And the things that you really notice is if you look around the mouth, the lines, the heavier lines that were sort of sitting there, they've been tightened up. And one of the ways that this works is if you're drilling all those tiny little holes, literally thousands of these little holes, if each one shrinks a tiny bit, the cumulative effect can be pretty significant. Now, it doesn't preclude a facelift. A facelift is needed in many cases. And that's why, Dr. Humphries and I will do facelifts, because sometimes this kind of technology, it doesn't give you enough. But for some people and in some situations, it can be very effective. So there's a little closer picture where you can see on the left sort of the heavier, what we would refer to as the marionette lines. And then on the right side, they're not gone, but they're softened. There's still some redness in the cheek there. That generally goes away with these treatments by about 6 weeks. Here's an example of a patient they did again. This is the fusion treatment where the fractionated as well as that resurfacing portion. And if you look on the left, you see there's a lot more pigmentation, irregular pigmentation in the skin, the heavier lines around the mouth. Those heavy lines around the mouth are sort of the bane of our existence, because people, whether they've been smokers or not, a lot of women will get those. The lipstick bleeds into it. They just hate those. We used a lot of heavier chemical peels during my training and when we were using the CO2 lasers, and you could get rid of them beautifully, but you ended up with a clown face because you also removed all of the pigmentation in the skin. So it really wasn't very helpful, but this is nice. They're improved. They're not gone completely, but you don't have that dramatic sort of pigment change. Here's just another example of the same kind of thing. Again, just smoothing out overall the pigmentation and just some general tightening. It's not a facelift, but it can really make a nice difference. So, where are we going in the future with these things? The holy grail for us is to be able to get dramatic skin tightening without making cuts. We're not there yet. That's why we're still doing blephs and brow lifts and facelifts. But there are definitely situations where these kinds of technologies can be very effective. Downtime is minimal, and they're extremely safe, and they're more cost-effective. So that's all. I just wanted to sort of give a brief overview of some of those things. And then now, as Dan was doing, we'll just sort of open things up, and if anybody has any questions.
Thank you.
I'm going to start, if that's okay. Okay, so this is a true story. A couple months ago, I go into Macy's and go to a makeup counter because I ran out of foundation. And this lovely woman, probably in her 70s, look, she had beautiful skin, a lot of makeup, but you know what I'm talking about, the lady that works at the makeup counter? She comes up to me and goes, "Oh, my." So immediately I'm like, what's wrong? I look that bad? Then she says, "Honey, how many steps of the 5-step skincare are you currently doing?" My mind is racing. What 5 steps are you talking about, lady? You know, I'm a surgeon. I don't have time. I don't know what they're talking about. So I said, well, that depends. What are they? Now, I'm not going to repeat them because I don't remember them exactly, but something to the effect of washing, toning, moisturizing, something else, okay? So the point is, she was very good at what she did because within 30 seconds, I felt horrible. I walked out with not only the foundation replacement, but clearly more things that are sitting in my drawer that I'm not using. So let me say the question is, what steps are your spouses, women lucky married to the experts, how many steps are they doing? What is real? What products are they using? I realize our skins are all different.
Yeah. Actually, you start.
Sure.
She knows my spouse.
She knows mine too. She may know all of our spouses. I think the most important 2 steps are, we talked about sun protection a lot. There's no question. And, many of us are very busy. We have, we're all professionals here. We have very busy lives. And sometimes it's hard to get beyond step 1 and 2. And sunscreen, number 1, every day. Number 2 is moisturizer. Beyond that, it's all icing, but all those other things help, but they don't help if they're in the drawer. I showed some pictures of the patients that do the hydroquinone every day for 6 months, and you can see it makes a dramatic difference, but you have to do it every day. And, for me, if there's 2 things, it's sunscreen and moisturizer. So, and that's what my wife does every day.
Well, my wife does sunscreens most days. She's slowly coming around to my philosophy. She used to have a drawer full of various potions and tons of makeup and all this. It sounds strange to say it, but if you look at people who've been camping for 2 weeks, their skin is great. For that matter, their hair is great. The hair may be a little bit oily, but it's nice and the skin looks nice. We don't need any of this stuff. Soap is a conspiracy by the soap companies to sell us soap. If you want to wash up under your armpits and, between the legs and wash your feet a little bit, be my guest. In fact, I think we all should do that. But beyond that, we are very well designed by nature. Skin takes care of itself. And I'm the one of the 3 of us who deals with all day long with people asking about their skin, particularly patients who have rashes and dry skin, which again is probably at least a third of us. Who here has never had any rash? All right. So, 1 out, and you do have beautiful skin. I know you. So, in general, skin takes care of itself. Unless one of my kids spit up on me, I never wash this part of my arm. There's no reason. And the skin here looks great, if I do say so. There's just no reason. What the companies want you to do, and bless free enterprise. I'm pretty hardcore in favor of free enterprise and in favor of low taxes and all that. But you don't, they're saying here, let's wash all of the moisture off your body. Let's wash off all the sebum made by your sebaceous glands. By the way, young people tend to be a little bit greasier. Mediterranean people like me tend to be a little bit greasier. It's actually good to be a little bit greasy. Greasy skin ages better. But don't wash away all that wonderful grease that you're not allergic to with soap that you might be allergic to, and then try to replace it with a layer of some other industrial grease. It makes no sense. So do less. Do less of everything. Yours? Yeah?
What do you do then for dry skin or rashes?
Well, my favorite is, the question is, so what do you do for dry skin or rashes? Well, obviously, if it's a real rash, I'm going to biopsy it. And sometimes it's a skin cancer called cutaneous T-cell lymphoma. If any of you knows of you or someone you know has a rash that isn't going away, get a biopsy. But as long as it's nothing bad, if it's just the basic dry skin rash, winter itch, my favorite is Vaseline at bedtime. People hate Vaseline because it's greasy, but I've had only 1 patient in all the tens of thousands that I've seen who had a real problem with Vaseline. Almost no one's allergic to it. Amlactin is another good product. I don't sell either of these. Amlactin is good. It's ammonium lactate. and it's over the counter. Get it at Walmart, not Walgreens. Walmart, you'll pay a lot less, or Costco. And that's less greasy. So if you hate grease, put that stuff on. But if you stop covering yourself with soap, you probably won't even need it. Now, for my patients who have real bad dry skin problems, people with hereditary, ichthyoses, for them I'll often recommend going all the way to wash the hair in the sink so they don't get shampoo running down their backs and legs. I also recommend for most people you don't need to wash your hair every day, even if you work out every day. We don't smell as bad as we think we do. Well, maybe you do. Maybe I do. No, in all seriousness, you don't need to wash your hair every day. I mean, honestly, heads don't smell that bad. And, try to keep soaps and cleansers off your skin. So just walk right past.
Hold on.
Okay, here we go.
The practical point of view, from a very practical point of view, though, how many people in this room put some form of makeup on?
That's going to be my question.
Okay, so I tend to fall with my buddy here that I think Dan is absolutely right. We overdo everything, but if you're going to be putting makeup on, you're going to need to be taking it off. And I like the idea of just a simple light cleanser. It doesn't have to be fancy. You don't have to have lots of chemicals in it. Just a simple light cleanser. And then the one thing that I do tend to add for patients is I'll say if you're going to do one thing, be consistent with it. I've liked the vitamin C, cream, some of the antioxidants. There's some, oily type ones that I do like. For them.
I'm fine with antioxidants on the skin. Vitamin C has been shown to have benefit on the skin. You're not taking it by mouth. It'll be fine. And also you can eat oranges. So, but back to you, Richard.
Yeah. So so that would be the one thing if I was going to say, the one thing like my wife does, the one thing that I try to do is use some of that, just a vitamin C. One of the nice things about the vitamin C using the antioxidant topically is that it does tend to stay with you, and then if you're going to be forgetting to put on, as I always do, the sunscreen, it will help a little bit and ameliorate some of that damage.
Okay. Yeah. So, first of all, I agree with everything Richard says. A lot of people wear makeup. Oh, the question is what kind of sunscreen? So I'll get to that first by saying heavy makeup. Anyone here remember Tammy Faye Baker? That's how sunscreen manufacturers test their sunscreen. So an SPF 70 means you've laid it on with a trowel. And that's an SPF 70. So I say the highest possible because chances are you're only getting 1/10 the benefit. If you're putting it on like a regular person, not like Tammy Faye Baker, you're not getting the benefit. And I like makeups with sunscreen in them. If you're going to wear makeup every day, may as well get some sunscreen in it. Taking it off at night, I really should have brought my wife here. I think there are nice makeup removers that are fairly safe. But sunscreen, the strongest one you can. I have some doubts about micronized titanium in sunscreens. They are nanoparticles, and there's some level of absorption for that. And the data, there's no data that they hurt us, but other medical nanoparticles you may be familiar with include asbestos, diesel particulates, and gadolinium contrast, all of which have dire health consequences. So I think we're in the middle of a multi-decade experiment about what micronized titanium is going to do to us, and I do not recommend it. The sunscreen I recommend is Neutrogena Healthy Skin, I think. You have to double check me on this. It has various things in it that are not titanium. You guys have any other?
I recommend it.
Okay. Sunscreen ingredients being hormone disruptors, absolutely. I mean, again, personally, A, I'm lazy, but B, I don't wear anything at all. I don't wear anything on my face. I'm 48 years old, and my skin, as far as I can tell, still looks fine. It's a testament to hat wearing. And, I'm a huge believer in hats. Wear sunscreen. If you can make it a habit, great. Are all sunscreens safe? I don't think so. Can't go much beyond that. I don't like head-to-toe sunscreen except for those few days on the beach. My short pitch on sunscreen is if you're going to take a beach vacation, by all means slather on the sunscreen. If you have melanoma in your family and you own a boat, sell your boat. Because you can't protect yourself. What's that? and buy sunscreen. Exactly. But, and also sunscreen on kids is an interesting topic. I don't want kids to burn, but I have no idea. Kids absorb more than adults do, and the jury is out on all of this. I'm supposedly an expert in the field, and I don't have good answers on any of this.
Can you comment on things like the Clarisonic or other of those, the mechanical things to sort of help wash your face and get more of the stuff off?
That brand I don't know about, but I will say that loofahs are amazing Petri dishes and retain all kinds of incredible microorganisms. And I'm going to recommend against anything. That'd be my personal take, would be don't use it. Wait, he may know more than I do.
Yeah, I use a Clarisonic. I hope it's not a Petri dish. It may be though. I try to rinse it off pretty thoroughly. No, I think that it's, and from personal experience too. I think if you're a person that has a lot of breakouts, for guys, because of all the hair follicles, very helpful. Reduces breakouts. Takes off old layers of skin. I think it's a helpful thing. It's a good way to clean and do a little light abrasion there too.
Do you replace the brush?
Yeah, you've got to replace the brush. Usually you can tell when the brush, just like a toothbrush, starts to get a little soft. You need to get a new one, and probably should replace it every couple months anyway. So.
And if it's for exfoliating and preventing ingrown hairs, I lied. I do put something on my face. Once every couple weeks when I remember, I put on tretinoin to prevent ingrown hairs, and it will also do a little exfoliation. So it's also not completely without risks. If you absorb huge amounts of it, it may have all kinds of effects. And I wouldn't use it if you're pregnant. But I don't think you absorb a whole lot.
Question. I've read that the natural seed oils are better absorbed into the lower layers of the skin. And Vaseline is a petroleum product or mineral oil sits on the top of the skin.
Correct. Okay, so here's the question. Natural mineral or natural seed oils are absorbed better in the skin, while Vaseline just sits on top of it and is not absorbed. And you're absolutely right. What I like about Vaseline is that it's not absorbed. It is essentially a dressing that lets your skin heal. Lets your skin heal underneath it. It prevents TEWL, transepidermal water loss, and TEWL is what happens when skin gets dry, and that causes all kinds of problems. It starts an inflammatory cascade. And you want to just stop that. And in kids, often you'll notice kids with dry skin, the one part of the skin that looks great is the diaper area because it's kind of occluded. And Vaseline just occludes and lets your skin heal underneath it. I wouldn't want you to absorb a whole lot of it. It is a petroleum product. So I think it's great that it's not absorbed. Seed oils getting into the skin is not something I'm familiar with. And probably before I say something else, no? All right. Well, I'm not familiar with that.
Every one of the cosmetic companies, sort of the hot thing is, what carrier can they put, whether it's an antioxidant or whatever the active ingredient is that they want to drive into the skin. What is the carrier that they can put it in that's going to be lipophilic, that's going to allow it to be driven into the skin. And, they've all got different ones. I think almost the most important thing to do with the skincare is keep it simple and do it consistently. I'd rather see somebody just do 2 or 3 simple steps that they do every day, morning and night. Keep it simple, and don't damage your skin. Don't use things with lots of the perfumes and that are going to cause problems.
I'm going to go back actually to something we talked about a little bit ago. How many of y'all wear makeup? Everybody? Oh, we got to wrap it up. Well, this is not a super upper of a thought, but there was another study recently demonstrating significant lead levels in a lot of different lipsticks, including high-end ones from Nordstrom's. So, again, I have a daughter now, and hopefully I'll have some influence on her until about age 15, and 14, 12, 10, okay. And I'm going to strongly encourage, what's that? Well, I'm going to strongly encourage minimal makeup. Not a huge fan of makeup, really. If it's going to be a sunscreen, fine. But think hard about everything you're doing to your skin. That it's not all benign. Whereas, the sun protection, being healthy, that's all benign. All right, we're wrapping up.
All right, I think we could keep going for a while. Thank you all so much. I want to thank our speakers one more time. And I want to thank the audience for all your great questions. And we have some business cards and some brochures and things, and they'll also take maybe a few questions up here at the front if you'd like to come up. And so thank you all for coming. And thank you all.